Welcome once again to another edition of Dashboard with Ojay. On today's edition, yes, I have a doctor, but he's not just doing the prescription thing or the syringe and needle thing. He's doing something a little bit out of his league, if I can use that word, but in a good way anyways. A big welcome to you today. Welcome to the show.
Thank you very much.
Amazing to meet you. When I first heard about you as a doctor in some other field, I'd seen a lot of your type, but most of the type, I see them, being medical doctors and then doing politics. Not doing medical doctors and not doing medicine or practicing some kind of medicine and then in IT. This is the first time I'm seeing someone doing this too. So what brought you here? What brought you into IT from medicine?
Okay. I mean, that's a very, very good question. My background is I'm an emergency medicine doctor in Manchester.
Emergency medicine?
Yeah.
Okay.
So A&E doctor in Manchester.
Okay.
So I deal with emergencies. That's my day-to-day job.
Okay.
And I see patients every day. I've been a doctor for about 6 years. And, I see patients and I see barriers to seeing the patients. There's, I just want to see the patients.
Okay.
However, there's issues that cause me that I can't see them as fast as I need to see them and things. So that's how I got into IT. So I started with a software company. So we created software to actually help A&E departments be more efficient. That's how the journey started. This in the UK. I started the company 3 years ago. It became very successful. And I came to Nigeria and I thought, actually, this is where I want to make more of an impact, a bigger impact. When I finished medical school 6 years ago, I actually came to Nigeria to work for 6 weeks. So I worked in some hospitals in Nigeria, in Abuja,
Just 6
and
weeks.
in Lagos. Well, actually, it's 6 to 8 weeks.
It's fine.
I actually stayed after, but it was a 6-week block of medical school. This was 6 years ago when I was just about to finish. And I saw some problems and I thought, actually, these problems, I can fix them. I can fix them.
You can fix emergency issues in our hospitals? you think you can fix them?
Not quite. Let's not go that far.
Because,
Let's not go that far. But no, I felt I could fix some of the problems we have in healthcare in Nigeria.
Okay.
I felt like I can bring affordable healthcare to almost anyone in Nigeria. Almost anyone. And that's my dream and that's my goal. And we're achieving that one step at a time.
Okay.
So that's how PriveDoc existed.
Okay, so PriveDoc is the name of an app.
It's an app, yes.
It's an app.
Yes.
It's not a physical entity that you could feel, touch, and have a relationship with.
You can touch the app if you like, but it's an app.
So PriveDoc is an app. So tell us more about PriveDoc and what exactly does PriveDoc do?
PriveDoc.
Yeah.
Right. What PriveDoc does is that it allows any patient anywhere in Nigeria at any time of the day, 2 o'clock, 8 o'clock, any time of the day, to consult and talk with a doctor.
Okay.
Within a few seconds. So that means that you can wake up at 2 o'clock in the morning.
Okay.
You feel short of breath or you feel a headache. You can go on the app and talk to a doctor within about 5 seconds.
So in short, PriveDoc is like the emergency tool that you intended to use to close the gap between patients who need to meet with the doctor and can't get to that place ASAP.
Yes, precisely.
So rather than go on, try to get a cab or try to get an ambulance, which most of the time don't exist, and then you travel all the way to the hospital.
Yes.
You just have to go on your app, on that PriveDoc app, and then just type in your information.
Yep.
And voila, you'll be with the doctors.
So you download the app for free on the Apple Play Store.
Okay, wow.
On either. And within a few seconds, you can talk to a doctor.
Who are your doctors?
We have a lot of doctors. So we have about 100 doctors in total at the moment.
At the moment,
100 doctors. About half of them are from Nigeria. The other half are from America and the United Kingdom.
Oh, wow. Like you have 100 right now as we speak.
100 right now as we speak, yeah.
And half of them, 50 of them are for Nigerians.
And Nigerian doctors.
And they are Nigerian doctors.
Nigerian doctors, yes.
Before I ask you about how you were able to bring them on board, because I know that Nigerian doctors won't do pro bono work. What were the things that you had to tick? What were the boxes that you had to tick before you came to the very end of saying that you have doctors that will be able to meet the needs of those who need emergency?
So you mean how we vet our doctors?
Yeah.
Yeah. So before a doctor can work with us, we see their CV. We actually verify that registered with the Nigerian Medical Council.
Okay.
And we make sure that they actually work in doctors and in good order.
Okay.
We actually interview them as well. So I spent about 6 months interviewing doctors before I came on our platform. Make sure that actually they're doctors that could uphold our values. Because, you know, I'll be honest, like, you know, sometimes you go to hospitals, and I found this when I worked in Nigeria, you know, that 6 years ago, that some doctors, their bedside manners is not very good. You know, they're not very, very polite. And, you know, for PriveDoc, we want it to be different. We want everyone who uses that platform to feel like the doctor's listening to you and doctor's helping you and doctor's here for you. And that's it. We have to make sure we get the right doctors. So we actually, you know, interview our doctors quite stringently and make sure that we get the right people on our platform, right doctors on our platform.
You make it sound so easy. We know the challenge that we have as regards data, as regards network for communication and what have you. And my grandmother is in the village, far away in Ekpoma, you know, and she needs to meet with a doctor ASAP. And she has an Android phone, you know, but you know what might happen when she just has less than 3G to send to communicate. So how would this be relevant to or with for her, you know, who is way down in the village and needs to speak with a doctor?
I'm glad you asked that question actually. Before we launched the PriveDoc platform, we did some beta testing in the field. So we went to the villages, we went to the rural areas, we went to the south, we went to the north, went to, you know, deep places in Kano, in Kaduna, in Abuja. You know, we went to Delta, went to many different places, Ede, we went to, you know, Osun State, Ogun State, and we made sure that actually, even if you have less than 3G, you can still video consult with the doctor, not just chat. Everyone knows you can chat, you know, with, you know, less than 3G. But our system, our platform, it uses low bandwidth internet. So that means that with 3G or less, you can still video call a doctor. And it's still very good quality. So that what we've done is that we made sure that the data consumption is so low, it's minimized. So that's how we actually started. So we did that test and made sure it was going to work how we wanted it to work before we actually rolled it out. That's
still kind of mind blowing, thinking about the fact that although communication services around will tell you that they give you 4G, they just give you G if you ask me. So even though you tell me this, you know, I want to see it, you know, in practical to see how effective it could be. But you're quite convincing, if I must say. So before I go on this question, one particular question bothers me right now. I need to talk to someone and then I have to chat or I have to make a video call. How much is it going to cost me to do that? And how am I going to be charged, you know, because I'm making a video call, or is that a phone call or just a video call or the SMS thing, the chat thing? So
there's three features. There's a chat, which is, you know, almost like, you know, like a WhatsApp kind of version. So you can actually chat. You can send videos, you can send pictures. In case doctor wants to see, you know, you say you have a skin rash. Doctor says, can I see it? You can send a picture of it. And then you have an audio call as well. So just like a normal call, voice call. So how much does this cost? So
or is it free? Why not free? So my mother in the village can't afford that.
Of course, see, you know,
I just assume that she can't afford it because it's free. Just tell me the price before I go.
It's free to download the app. That's number one. It's free to download the app. And one thing is that people think, oh, because, you know, we're a UK company that comes to Nigeria, that it's going to be very expensive. Actually, like, we're making sure this is affordable to almost anyone. So our pricing point was key to us. And we studied to see exactly what we thought would be affordable. To chat to a doctor, it's 150 naira.
Come again?
150 naira to chat to a doctor.
Chat? For how long would that be?
That's until the doctor solves your problem.
Until
they solve your problem.
What if it doesn't solve my problem? What if it's not able to meet my needs or so prescribe the right?
So then we prescribe something else. So, like, you know, the point is that, you know, what people don't understand is that in medicine, as a doctor, I can tell you, any doctor will confirm this to you. 8 out of 10 times, you don't need to see a doctor in person for them to actually treat you and diagnose you. Just by talking to you, they can diagnose you, treat you, and make sure you're okay.
So they don't have to look at your eyes, feel your temperature, feel your heartbeats, and all of that.
No. So 8 out of 10 times, they don't have to. Only 2 out of 10 times a doctor needs to actually see you in person to actually diagnose you. So most times when doctors touch you, they do not have to confirm what they already know or what they already think. You know, so it's something that we pride ourselves on. It's, you know, 150 naira, you can chat to a doctor. For 1,000 naira, you can video call a doctor.
For 1,000 naira.
Yep.
So it's not it's the same thing as chatting with a doctor.
No, so the chat is like text, texting.
So you get feedback.
You get feedback.
So if you're the doctor right now,
Yes.
and I'm the patient right now,
Yeah.
and I have stomach pain or something,
Yep.
I don't get fall sick. Okay, the worst I have is
Thank God.
say malaria. So I say so, not that I want to spoil your business, but I just wanted to know that I'm careful most of the time. So I have a challenge with my tummy, and I need to speak with a doctor right away. So I pick up my phone, and I
download the
I
app.
go. Let's assume that I have the app, or should we start from? Okay, I download the app.
Yeah.
Okay. So what do I do next?
You download the app.
Okay.
You put your details in, so your name, your demographics, so your name,
Okay.
your
Location.
surname, where you are. But you have to put your location because
Okay.
it doesn't really matter that much.
Okay.
Your name, date of birth,
Okay.
and then that's it.
Name and date of birth.
Yes.
And
And your
so-
phone number, obviously.
Okay. And so what
and
happens
then,
next?
And then from there, you can then decide what you want to see. You can decide if you want to chat to a doctor by
Okay.
text.
Okay.
You can decide by chat.
Okay.
Or you can decide if you want to video call a doctor.
All right. So what if I want to speak with an ophthalmologist because of my eyes, and the doctor available there is just a general practitioner?
No, so we have all range of doctors. We have specialists on our platform as well. So we have we have general practitioners. We have specialists.
Okay.
We actually have physiotherapists as well.
Oh wow.
So there's actually a wide range of things that we have on our platform.
Oh wow.
Yeah.
Wow. So no matter the challenge, there's a doctor to meet
There's
my
a doctor
need.
to meet your need. Yeah.
Wow. So when we have a conversation, they come to a conclusion or some diagnosis or something. So how do they make that conclusion? How do they prescribe without even testing? Because most of the time I know that doctors will ask you go do a test to confirm this or that.
Yeah. So you don't always have to. They might tell you sometimes, okay, before we can actually proceed, you need to go and do this test, or you need to do this, do this, or do that.
Okay.
That's only sometimes. Most times they can say, actually, this is what you need from what you've told me. This is what you need.
Okay.
Try this and let me know how it goes.
Wow.
And that actually solves the problem almost all the time.
Wow.
So-
This sounds like some kind of miraculous science mixing up together. Science and miracle. Sorry. It's just amazing.
The thing is that in Nigeria, there's a shocking statistics we have, right?
Okay.
And that is, we have less than 4 doctors per 10,000 people in Nigeria.
And it's getting worse than that. Looking at the fact that there's so much economic migration out of the country, doctors are leaving every single day. So if you say 4 to 1,000,
4 to 10,000.
Okay.
So every
that's even more.
So for 10,000 people, we only have 4 doctors in Nigeria.
Okay.
That means we have 1 doctor to 2,500 people in this country. That's one of the worst in the world. It's one of the worst in the world, and the things are just getting worse and worse. It's just getting worse. So it's something like actually accessibility to healthcare is actually just it's getting worse in Nigeria. So it's something I'm trying to make sure that using PriveDoc, we can actually solve that problem as much as we can.
So do you think the 50 doctors you have will be enough, or are they even enough as we speak to meet the needs of people of Lagosians? Just say Lagosians. Don't even let's talk about my grandmom.
No. So we're getting doctors. So we have probably about 10 doctors join our platform every 2 months.
Okay.
So 5 doctors a month join our platform.
Wow.
So we're growing and growing and growing. And we have different language speaking doctors. We have doctors speaking Hausa, Yoruba, Igbo,
So that you can click on what language you want to speak in also.
Yeah.
Wow. That's kind of revolutionary, if I might say. So what has been your biggest challenge so far in this stratosphere, Nigerian, area? What has been the biggest challenge in getting this thing done? I'm sure it's not as easy as you're making it sound.
No. It's been a quite difficult journey.
Herculean,
might I say. There's things that's happened that, there's a trust factor.
Okay.
There's a trust factor. So people think that oh, this is too good to be true. This is so cheap. This is magic, and this is not. So there's something fishy about this. But actually, it's just this is technology that we have, technology that exists, and we're using it for the betterment of the population. So I think it's actually getting people to actually trust.
Yeah.
To trust the platform. That's the biggest hurdle. The second biggest hurdle is. You might laugh at this.
Tell me.
The mindset that everyone in Nigeria is trying to do 419. right? So people think that, that their card details or something is not safe on the platform,
Okay.
whereas actually it's very, very safe.
Okay, so talking about payments now, means of payments. So
Means of payments.
I have to use my card to get access.
Yes.
So without that, I can have access to it.
No, so you can in the app. There's 2 ways of paying.
Okay.
You can pay by using your card.
Okay.
You can pay by bank transferring.
Okay.
Within the app.
Okay.
And there's other ways of paying which we're actually introducing in the next few months that will actually make sure that actually anyone, anywhere, even people who don't really have access to maybe online banking or they've lost their cards, they can actually still pay.
Wow.
So there's things that we're doing to sort of negate that.
Wow. How much have the state government or federal government been involved with your projects, or has it been totally private?
So see, in the UK, we work with the government over there.
Okay.
And actually, so my company in the UK is funded by the UK government innovation arm.
Oh wow.
So they funded us to actually do the pilots which we initially did in the UK for part of the software. We have also investors as well in the UK who support us. I just find that by going at it, at our own pace, we can go as fast as we want to go without having hindrance. We've had governments interested in working with us, but I think that to target the people we want to target, I think we need to do it in a way that we see best. We don't want any sort of curdling of how we want to do things that will actually detract from what we're doing.
Wow. So you're going solo on this. So any private investors so far in Nigeria?
There's been a few interested.
Okay.
And we might take them up on that offer, but at the moment we don't need any investment in the business. I think it's fine how it's going.
Okay.
When we try to scale up in a much larger way, then we might need investment in Nigeria.
Okay, so I want to call my doctor right now. I want to have a video chat with an unknown doctor, right? It's not as if I can pick a particular doctor every time I go on the app.
So we do something. We do something which is actually quite smart in our platform.
Okay.
The doctor you saw the first time, we try to match that doctor to you.
Okay.
So we'll tell you, if you try to book again, we'll say, actually, your doctor's available during these times.
Oh, okay.
So make sure you can see the same doctor. For continuity of care, is very, very good. And
to show the history of what the previous doctor has prescribed or...
continuity of care to make sure the doctor you're seeing knows you a bit.
Okay.
So we make sure you see the doctor as much as possible. It's not always possible.
Okay.
But as much as possible, we'll make it happen. But anyway, your medical history, if you allow the doctor to share it with the other doctor, you have the option as well. So the doctor you see next time can actually share your medical history with the doctor you see next.
Okay.
So
I'm bound to Nigerian doctors. I can't say I want to see some doctor in India or some doctor in the UK.
No, you can. So we have American, we have doctors from the US, we have doctors from the UK as well.
Okay.
GPs and specialists as well.
Okay.
Obviously, because of the exchange rate and things, the price differs. And actually, to be fair, most people actually want to see Nigerian doctors on our platform. We only had a few people who actually want to see UK doctors because they want a second opinion or something of the sort. But actually, Nigerian doctors are actually the most popular on our platform. Okay, so it's Nigeria. So
all of this is just so that we can get a diagnosis, right?
Yes.
So what happens to the actual medication being delivered to the client or to the patient?
That's a very, very good question you've asked. We have two solutions to that problem. Okay. The first one is when you see the doctor says, okay, I've seen so-and-so, I've seen John. John needs amoxicillin or whatever medication, antibiotics. The doctor will then prescribe that medication. Okay. And the way we do it is that the prescription the doctor prescribes is legally valid because it's signed, it's dated, and the doctor's registration number is also there.
Fine.
So actually then on your phone, you have a digital prescription which you can take to any pharmacy anywhere in Nigeria, and they'll dispense that medication for you.
Wow.
In Lagos at the moment, we're trying a new service where you can actually order your medication from our platform as well.
Okay.
So, the doctor prescribes it. You don't want to go to a pharmacy or you're not feeling well enough. You can actually order for someone to actually bring the medication to you.
Wow. So
it's available in some locations, not every location. We're still expanding it. Wow. But in most parts of Lagos, that's available.
Wow. That's quite interesting. And it's good that we're seeing this kind of thing happen, in our time and making use of technology and whatever. So where's the future of PriveDoc going to? What? All I know right now is you're telling me that I need to just trust some unknown, guy who is going to prescribe to me drugs or tell me what my challenge is as regards to my health. And what's going to happen in the future when all of my information is sold to some other data miners who would give you everything, just to make sure they get your information, because you could be one of those guys who knows what's going to happen in the future about my data, about my information, about my history.
So I think I want to make something very, very clear, right?
Okay.
Is that before being a technologist, I'm a doctor at heart.
First off,
I'm a doctor, and as a doctor, the patients are my first concern. So you can be rest assured that the data in PriveDoc is not being sold to anyone.
Okay.
It's only for your own good. You know, the thing is that, you know, we're getting to a stage where we want to be able to help people become healthier. One thing that, and this is a pet peeve of mine, right, is that people seek, I shouldn't say pet peeve, but people seek medical help only when they're sick.
Especially for people like us, people in this part of the world, until we can't get up from our beds.
Exactly.
We don't necessarily go do checkups.
Exactly. And it's a massive problem. Massive. I can't describe how big that problem is. It's massive. You know, people only see a doctor when they have chest pain. Whereas actually, if you see a doctor regularly, the doctor could have told you 10 years ago, you have hypertension, you have high cholesterol.
Chances that you have those things in the future. Okay.
Yeah. And then they would medicate you and treat you.
Okay.
Before you get to a stage where you have a heart attack or you have chest pain or you have angina. You know, there's people don't just get sick at the end of suddenly.
Yeah.
There's normally preceding factors that happens before you get sick. There's risk factors which you might have, which if you speak to a doctor sooner, they can help you, negate those risk factors to make sure you don't get sick in the future. You know, one thing is a shocking statistic, right? But in Nigeria, right now, average age of living is 54 years old.
Okay.
So life expectancy is 54 years old. 54. Right now, as we speak.
Okay.
Right? In the rest of the world, the average is 72.
Okay.
So I'm saying to you that people in Nigeria are dying much sooner. And it's just
the natural thing that came to me right now, without me saying it, like, God forbid. That's just the instinctive thing that came.
Yeah, but what you should be doing is you should be going to see a doctor to make sure that your blood pressure is not high.
Yeah.
To make sure you don't have diabetes. To make sure that everything's working fine. It's a problem. It's a problem. You know, like the little things like the fumes we inhale in Lagos.
Yeah.
Makes a massive difference. Massive difference. It's actually, you know, as you drive in the streets every single day, you know, you're inhaling, you know, this toxic fumes, which are having a, you know, effect on your body. I don't know if you know about free radicals, but basically,
free radicals, free electrons. Okay, yeah.
You know, when you have toxic substance in the air, that affects you, right? And you know, it's something that we don't think about it until, you know, it's too late, and you know, we have a problem down the line, and then you're trying to fix the problem. You know, like that thing, you know, being younger, you know, they went to prevention is better than cure. It's so true, but until it happens, you actually don't understand. Yeah. So I just want, like, honestly, my wish is that PriveDoc didn't need to exist. I wish that everyone was so healthy that we didn't need to have this sort of system. But that's not the case. People are unwell.
So where's the future of PriveDoc? Where are you guys getting into after this phase, after this stage? What else are you guys going into? Do you just want to remain just give us this service, or you're doing something?
No. I mean, so we have plans, and you know, but you know, it's a stage by stage process. Okay. We plan to be the largest digital health provider. Okay. In Nigeria, first of all.
Do you guys work with the HMO, the health insurance people?
Yes. Some of them we do.
So if I'm under an HMO, for example, I don't have to be charged, or how is it going to be done if I'm supposed to talk with a doctor and I have an HMO?
If your HMO sign up to work with us, then yes, you won't be charged. And some HMOs are working with us, and that's completely fine. Oh, fine. But you know, it's not always within our power. And the things that you have to understand that for a lot of people, for a lot of corporations in Nigeria, you know, it's about profit and profit. You know, so you know, for us, you know, it's a service that, you know, we actually want to provide to people as cheap as possible.
So how much you pay your doctors?
So
out of 150 naira or out of 1,000 naira for video calls, how much does the doctor get to make, and how much do you guys make?
So it's a very, I'm glad you asked that question. I like to be transparent and open about everything we do. The doctor keeps 90% of the transaction fee. Really? So for the 1,000 naira that the patient pays for a video call, the doctor keeps 900.
Wow.
We keep 100 naira to maintain the platform.
And you don't make any profit for yourself?
The 100 naira is
you make a profit from that, and you service a platform from that?
Yeah, that's all we keep.
Oh, wow.
That's all we keep. You know, you have to be honest, you know, it's cost us thousands and thousands of pounds to make this platform. Thousands of pounds. I remember, my investors, when they saw, what we've done in Nigeria, they said, okay, well, this is, you spend a lot of money here, but actually, the future is much brighter.
How long does it take you to make your money back from Nigeria, from the Nigerian market?
That's a good question. How long is a piece of string?
Nice one. You speak with so much exuberance and so much energy and so much belief in this app, and I want to believe that everybody was going to pick up that app is just going to find it as easy as you say. Just go to your app store or your iOS. You click on the app, download it, fill up your information, and yeah, my data, my credit card, my information as regards my card is safe also. My history is saved also.
Everything's safe.
My health history is saved also. Everything is saved. And I click on it and I make a message and then I speak with a doctor or I chat with a doctor and there's a proofread to my challenge and I go get the drugs somewhere and I take it and I'm healthy.
Yeah.
That's the end goal.
That's end goal, yes.
That's the end goal.
Yes. At the moment, yes.
Mr. Olaitan, this is marvelous. Thank you so much.
Thank you so much.
For
Pleasure.
coming. Yeah.